Have you ever been on a roller coaster before? As the roller coaster moves up the hill, you may feel anxious or scared. But as soon as you reach the top, you may feel at ease and less scared. So these emotions are going back and forth, and this is kind of similar to bipolar disorder and how patients feel with bipolar disorder. And what is bipolar 1 disorder? Well, it causes extreme mood swings that include emotional highs and emotional lows. With the emotional highs, you may feel excited or overjoyed, but there's also emotional lows. With an emotional low, you may feel hopelessness, you may feel depressed, maybe loss of interest in some activities. And these mood shifts may occur only a few times a year or as often as several times a week. And according to Dr. Long, a psychiatrist from Canada, in between these episodes, many people with bipolar 1 disorder can live normal lives. And we're going to begin with the manic episode. So, according to the American Psychiatric Association, during a manic episode, symptoms include increased self-esteem, decreased need for sleep, more talkative, and maybe easily distracted. And in a manic episode, a person has elevated mood swings lasting at least once a week. And a manic episode may have been preceded by or maybe following a major depressive episode. So, at least 3 times in a lifetime, a manic episode is required for the diagnosis of bipolar 1 disease, which doesn't seem too much, but that's what it is. And manic episodes usually begin abruptly and last for about 5 to 6 weeks. And now on the major depressive episodes here, according to the American Psychiatric Association, again, the symptoms may include loss of interest, change in weight, decrease in energy, and difficulty making decisions. With a major depressed episode, you have extreme negative feelings and self-judgment. And symptoms cause significant occupational or social distress and impairment, so with jobs and education, it may be hard to focus. And now an interesting one, which is a mixed episode, which includes symptoms of both the manic episode and the major depressive episode. And with this, the severity is enough to cause occupational impairment, hospitalization, and even psychotic features. And this needs to happen both every day for at least once a week. And uncontrollable swings between racing thoughts and feelings of being in blackness will happen just in minutes. And these episodes are also extremely rare. As I explained earlier, these are the ones that are usually more likely to occur. And these symptoms are not due to any medical condition or a substance or anything. This is truly their personality. And for the course, according to Dr. Long, research findings indicate that women with bipolar disorder may have more depressive and mixed episodes than men. Men tend to have more of the manic high episodes, and the average age that these occur would be age 18. And with these episodes, they usually occur with about 5 years in between each episode, and every time that each episode happens, then it gets more severe every single time. Okay, and here are differential diagnoses. So bipolar disorder has a bunch of the symptoms that I just listed off, but major depressive disorder, PTSD, and ADHD may have similar symptoms. This makes the bipolar disorder difficult to treat and difficult to diagnose. So it is important to diagnose bipolar 1 disorder with the manic episodes and the depressive episodes. And for treatment for bipolar 1 disorder, medications are very important. And treatment is solely based on the symptoms that you have with your bipolar 1 disorder. And according to Dr. Goldberg from WebMD, whether you have bipolar 1 or 2, these medications up here will help. And they are mood stabilizers, antipsychotics, antidepressants, and anti-anxiety medications. And there's also therapy that is highly recommended for bipolar 1 patients. And psychotherapy is a key part of treatment. And significantly, cognitive behavioral therapy looks at connections between thoughts and behaviors and helps change your negative thoughts to positive thoughts. And although my references were at the bottom of each slide, here's a full list of them. And thank you.